colleagues, partners and friends. I am pleased to join the 12th update day of tuberculosis and post-COVID-19 of the Red TBS-Stop Epidemias. As we come together to commemorate World TB Day, we stand in solidarity with the millions of people who fall ill with TB each year, and remember the millions who have lost their lives from this preventable and curable disease. We would like to salute all the health workers at the forefront of the fight to end TB and other diseases, including communities, civil society and advocates, national TB programs, partners and donors for their tireless dedication and support to the fight to end TB. This is a pivotal moment for the global fight to end tuberculosis, or TB. We have strong commitments with concrete targets made by world leaders in the political declaration of the second UN high-level meeting on TB held in September 2023, which provide a strong impetus to accelerate the TB response. 2024 is a year of action to ensure these commitments are met and millions of people benefit from life-saving TB prevention and care services, saving lives. While global efforts to combat TB have saved an estimated 75 million lives since the year 2000, TB still remains one of the world's deadliest infectious killers. Each day, over 3,500 people lose their lives to TB, and close to 30,000 people fall ill with this preventable and curable disease. This preventable and curable disease continues to place an enormous human and societal toll on those affected, their families and communities. Last year, WHO reported that there has been a significant recovery worldwide in the scale-up of access to TB diagnosis and treatment services, with the highest figure diagnosed recorded since WHO began global TB monitoring in 1995. It shows an encouraging trend of progress. There is some progress as well in the development of new TB diagnostics, drugs, and vaccines. However, this is constrained by the overall level of investments in these areas. WHO Director General Dr. Tedros Adhanom Ghebreyesus officially launched the TB Vaccine Accelerator Council in September 2023 to facilitate the development, availability, and use of new TB vaccines. The Council aims to identify innovative, sustainable financing, market solutions, and partnerships across public, private, and philanthropic sectors. The theme of World TB Day 2024, Yes, we can end TB, conveys a message of hope that getting back on track to turn the tide against TB epidemic is possible through high-level leadership, increased investments, faster uptake of WHO recommendations, and multi-sectoral action. Following the commitments made by heads of states at the UN high-level meeting in 2023 to accelerate progress to end TB, this year's focus shifts to turning these commitments into tangible actions. On World TB Day, WHO is calling for action on several fronts to ensure that the commitments made to end TB are achieved. First, we are calling for high-level leadership and action to end TB. Now that we have strong high-level commitments made by world leaders in the political declaration of the second UN high-level meeting on the fight against TB, we must unite forces to translate these commitments rapidly into action. This includes implementing the WHO Director General flagship initiative for 2023-2027. The targets include reaching 90% of people in need with TB prevention and TB care services using a WHO-recommended rapid test as the first method of diagnosing TB. ensuring that all people with TB have access to a health and social benefit packages, ensuring the availability of at least one new TB vaccine that is safe and effective, and closing funding gaps for TB implementation and research by 2027. Second, we are calling for sustainable investment of resources. Support, care, and information are vital to ensure universal access to TB care and for research. This is especially critical to close gaps in care and to ensure equitable access to prevention and care in line with the WHO's drive towards achieving universal health coverage. More investments towards supporting the rollout of WHO-recommended TB preventive treatment options, shorter TB treatment regimens, rapid molecular diagnostics and tests for TB infection, other innovations and digital tools will lead to improvements in health outcomes and save millions of lives. Importantly, investments in research and innovation are vital to fast-track efforts to reach the end TB targets. Third, we are putting the spotlight on the importance of tackling health inequalities, including stigma and discrimination, to ensure health for all. People with TB are among the most marginalized and vulnerable and face barriers in accessing care. WHO is calling for global action to address health inequities for people with TB and other diseases. Fourth, we are calling for a scale-up of access to TB preventive treatment and screening services for TB disease, as this creates efficiencies and can lead to massive health and financial gains. Integrating TB screening with TB preventive treatment increases opportunities to protect people from falling ill with TB, as well as saving a large number of additional lives. To help countries scale up access to TB preventive treatment, one of the key targets in the UN political declaration, WHO is releasing an investment case on scaling up the rollout of TB preventive treatment on World TB Day. Fifth, ending TB requires concerted actions by all sectors, community, and the civil society to provide the right services, support, and create a safe environment in the appropriate place and at the right time. Poverty, inequality, malnutrition, comorbidities, discrimination, and stigma are major drivers of the TB epidemic. Thus, progress in combating TB and its underlying causes cannot be achieved by the health system alone. WHO is working closely with the countries to support the adoption of the multi-sectoral accountability framework and calling for strengthening multi-sectoral engagement and accountability. All these joint actions can help drive the TB response to save lives and achieve the global TB targets. We at WHO collectively recommit to keeping the promises made to the millions affected by TB each year, despite any hardships, challenges, or crises that come our way. The next 5 years will be critical for ensuring that the political momentum we have now is translated into concrete actions and accelerate progress towards reaching global TB targets and commitments. As requested in the second UN High-Level Meeting Political Declaration, WHO will continue to provide global leadership for the TB response, working in close collaborations with all stakeholders until we reach and save every person, family, and community impacted by this deadly disease. Join us. We need your strong personal efforts to put an end to this millennia-old killer. Together, yes, we can end TB. Thank you.